Hi, this is Carol with an overview of shared services in Primum. The purpose of this video is to get you familiar with the concept of shared services and how we implement it in Primum. First, we can start with a quick definition of what a shared service is. Shared services is a term that describes when both a physician and an advanced practice provider from the same group evaluate and manage the patient on a single date of service. An advanced practice provider, or APP, is a term that describes a nurse practitioner or a physician assistant. To expand on our definition, here is a clinical care example of shared services and how it pertains to coding and billing for that care. We have a physician assistant, or APP for short, Kathy Collins, who sees a patient with abdominal pain and anorexia on the inpatient unit. Kathy performs and documents the H&P exam, discusses the case with the hospital's physician, who later sees the patient, and together they decide to obtain a CT scan. The physician does documentation to support shared services and signs the chart. The chart is billed out under the physician's name or number since the physician documented a face-to-face encounter with the patient and contributed to the documentation of the physical exam and medical decision-making. In Primum, we're introducing a new concept called the hospitalist care team. Another term for this is a shared services team. Primum now allows you to assign both a physician and an APP to a patient. Both the patient list and the rounding list have a new column showing who is on the care team. The next two slides will show how this information is presented. This is the patient list view. You will notice that next to the assigned provider column, we have added a new column called assigned APP. Both the assigned provider and assigned APP make up the care team for that particular patient in Primum for the selected date of service. For patient Jean Anderson, the care team comprises Dr. Carol Hart as the provider and Michael Davidson as the assigned APP. Of course, you can have circumstances in which an APP is solely assigned to the patient or vice versa. Another thing to note is the physician's name will always appear in the assigned provider column, but never in the assigned APP column. In the rounding list view, we've added a new column, the hospitalist care team column. For the first patient, Daniel Tidwell, we see a single assigned provider's initials and the degree indicating that this provider is a physician. The green dot next to the initials tells us that this physician has entered an E&M encounter for this date of service. The seen bar here tells us that this patient has been seen by the hospitalist physician group, whereas the care team column shows us who on the care team has actually entered an E&M encounter. The next patient, Lee Smith, has also been seen by the group, but in this case, two providers have been assigned to this patient for the day, and only the physician has actually seen this patient. Lastly, David Carden has been seen by the group, and he has two green dots next to the initials of both providers in his care team. This tells us that both the assigned physician and APP were involved in his care. The hospital's care team is also implemented in the encounter form. You will notice here the addition of a share button. This button will be present if an E&M encounter is entered by one of the assigned providers to allow for the other assigned provider to easily share the encounter. In this example, if I'm viewing this screen as the APP assigned to this patient, I would open the encounter and click the share button to add my name to the encounter. Right away, it will add the APP's name in the encounter, as you can see here. In addition, the APP can now edit or delete the encounter. You'll also notice the APP's initials are shown on the top of the encounter box next to the physician's name. This will help the users to easily identify all the shared encounters entered for this patient. In summary, shared services allows for patients to be assigned to an advanced practice provider and a physician using the assigned APP column on the patient list. The assigned providers make up the patient's care team, which is displayed on the rounding list with the provider's initials. Green dots next to the provider's initials indicate whether a shared service has been performed by one of the assigned providers. An E&M encounter entered by one of the assigned providers now has a share button for the other provider to easily share the encounter. Thank you for watching. Please feel free to direct any questions you may have by emailing us at primum@symmetricrs.com.